Well, good afternoon, everybody, and welcome. My name is Adrienne Griffin. I am the Executive Director of Maternal Mental Health Leadership Alliance. And on behalf of everybody at MMHLA, we are so thrilled to be welcoming you to today's webinar, which is Demystifying Digital Maternal Mental Health Platforms for Providers. This is part one of a two-part webinar series, and the second one will be focusing on platforms that support parents. We are so thrilled to welcome all of you and to thank our sponsor for today's event. Next slide, please, which is the California Healthcare Foundation. And please mark your calendars for the second part of the webinar, which is October 23rd, Digital Maternal Mental Health Platforms that focus on supporting the mental health and well-being of parents. Next slide, please. So a quick poll just to help us gather information about who participates in our webinars. Which profession do you most identify with? And there we go. Tell us about yourself. Just take a second to do that. That would be terrific. And we actually have somebody on this webinar from Malawi. I think this is a record. That might be like the person furthest away that we've ever had. So welcome. We're thrilled that you're here. Okay, next slide, please. So just a little bit of housekeeping before we get started. Anybody who's new to the Zoom room, there is a Q&A section. Please, if you have any questions, put it in there rather than in the chat. You can use the show captions to see live captions and use the emoji button to share your reactions. Next slide, please. And after this webinar, we will email you a survey to get your feedback. We will share these presentation slides as well as a recording of this webinar. And we will also be sending you a fact sheet with information about each of the digital platforms that you will hear about today, as well as a link to register for part two of this two-part webinar series. So yes, it's being recorded, and yes, we will share the recording and all of the slides. Next slide, please. And here is just a quick look at our terrific team at Maternal Mental Health Leadership Alliance. We are a small but mighty team. There's only 10 of us, half part-time, half full-time. We are a nonpartisan, nonprofit organization leading national efforts to improve maternal mental health in the United States. We focus on three strategic pillars. We advocate for change, we build partnerships, and we curate information for the field through events like this. Please check us out on our website, mmhla.org. And in particular, go to the Resource Hub and you'll see all kinds of information that we share, including webinars and fact sheets and the kinds of things that you'll be seeing today. Next slide. So just to orient all of us, what is maternal mental health and why do we care so much about it? These are conditions that occur during pregnancy and up to 1 year following pregnancy. They are the most common complication of pregnancy and childbirth and a leading cause of maternal mortality. We know that 1 in 5 mothers are impacted each year. That's about 800,000 families in the United States, and many more in high-risk communities who include women of color, parents with a baby in the NICU, military mothers, individuals with a history of mental health conditions, and the list of risk factors goes on and on. That's why we think it's so important that all pregnant and postpartum people are educated about and screened for mental health conditions. And these include not only depression and anxiety, but other disorders such as OCD, PTSD, bipolar illness, psychosis, and substance use disorder. So we used to say postpartum depression. We say it's not just postpartum and it's not just depression. These conditions often start during pregnancy, and they are much more inclusive of illnesses, not just depression. Next slide. So we know the maternal mental health crisis in the United States is severe. As I said, 800,000 families each year are impacted by maternal mental health conditions. And as many as 75% of those impacted actually never receive care. This leads to significant impact on the mother, the baby, family, and society. It costs $14 billion each year in our country for not treating these illnesses. We're talking about costs of mental health for the mother, for the baby, as well as lost wages and productivity. And tragically, we know from the Centers for Disease Control and Prevention that 22% of maternal deaths are attributed to maternal mental health conditions. Every time I say that, I feel like somebody's punching me in the stomach. How is this possible in the country that spends more per capita on healthcare than any other country, that we have these horrible, horrible statistics? Next slide, please. So what can we do about it? Well, we lead all kinds of efforts to advocate for resources and funding, but we see more and more that digital platforms are offering promising solutions to improve care and expand access, especially to people in healthcare deserts. And we know with changes in Medicaid, we know with more and more rural hospitals closing, that it is technology that is what is going to be driving mental health in the future. Next slide. And so that's why we put together this long-awaited webinar. First, let's just have a look at what digital platforms or technologies are. They run a wide gamut. If we look on the left, we see enterprise systems and support. So these are things like electronic medical records, and things support hospitals and large health systems. All the way over to the right are patient-facing therapeutic interventions that can be downloaded from the App Store, things to help with things like maybe cognitive behavioral therapy or meditation. But what we're going to be focusing on today is the area in the blue box. So these are platforms or technologies that are supporting the clinicians in how they are providing services and support to pregnant and postpartum parents around their mental health. Next slide. So the question then is, which technologies are safe, reliable, and effective? It seems like every day there's a new platform, a new technology. You know, I look on the websites, and it's hard sometimes to make sense of what information is being provided. And so that's why we have carefully cultivated a few companies, next slide, please, who you'll be hearing from today. These companies provide maternal mental health platforms. They've been carefully vetted by our organization. We've been working with all of them for the last year and a half or so. They are actually members of our technology council. They pay a small annual fee to fund professional development and networking opportunities. They've been learning from each other, and they share our commitment to promote the mental health and well-being of our nation's mothers and childbearing people. So about 2 years ago, we started, learning more and more about these platforms, and we made a commitment that we would identify companies and platforms that are doing a good job and are really focused on maternal mental health. Next slide, please. And so these are the 5. Oh, I'm sorry, one more thing. So these platforms help health. They're specifically focused on helping healthcare providers deliver more effective maternal mental health care and to improve the efficiency of their practice operations. And these are the 5 companies that you will be hearing from. Mama is going to focus on screening. Baby Scripts does remote patient monitoring. And then we have 3 companies that focus on supporting collaborative care models. So we'll talk a little bit about what the collaborative care model is and then hear from each of them. Okay, so we are ready to get started. So first up is Mama, and we will be hearing from Crystal McCauley, and she will be talking about how Mama helps providers screen for maternal mental health conditions. Crystal, please take it away from here.
Hi, Adrienne. Thank you so much for having us, and thank you to the Maternal Mental Health Leadership Alliance for putting together this amazing program today. I cannot see myself, so I just want to make sure that you can see me. Oh, there I am. Thank you very much.
And we can see you.
Perfect. Thank you so much. So my name again is Crystal McCauley. I'm honored to be here as the National Expansion Director for MAMA. MAMA is a full spectrum perinatal mental health platform and program that starts with evidence-based screening. We give instant scoring and connect patients to perinatal trained clinicians. We deliver robust tracking, ongoing support, and closed loop follow-up to all of our parents. MAMA was created by those that experience their own maternal mental health conditions. So we all come to this work very honestly, like most of us do. Our collective real world experiences being ping pong between providers and given outdated referral sources brought us to bring MAMA to life. So we are, next slide, please. So MAMA is proud to be the behavioral health solution for the March of Dimes. We're supported by Johnson & Johnson Maternal Mortality Quickfire Challenge, the Department of Health and Human Services Postpartum Equity Challenge, winner of Phase 1 and 2, We're also the recipient of the American Heart Association Award for the Bernard J. Tyson Social Impact Award. So it's been an honor to have these awards brought forth for our group, and I will go ahead and say next slide, please. So screening specifically. So what Mama does is gets rid of all the paper. Right now, what we find is that the gold standard in most offices and hospital settings is the doctors say, oh yes, we're screening. We give them the EPDS and they fill it out and they put their name on the top and we score it and we give them a piece of paper that has the resources in our area. And that's what we can do. So Mama gets rid of all that. What we do is we provide an opportunity for a parent to scan a QR code where they're then directed to take the EPDS or the PHQ-9, whatever screening tool that we would like to utilize with that facility. They received an instant score, which is then shared with their provider and also goes into our Mama backend portal. And they're instantly going to be connected with a care coordinator. So we really take all the guesswork out and digitize all that paperwork. So now you have the score digitally. Most offices, again, are screening on paper, and we can screen anywhere that you find new and expectant parents. So pregnancy, postpartum, NICU, OB office, pediatrician's offices, we can screen anywhere that parents are found. I will go next slide, please. So this is one of our doctors sharing how much she loves to use our platform because it's so easy. Thank you. This is my face when you take over the situation. We work directly with doctors. We integrate into EHRs. We're into the workflows that are already established by their practices. So we will meet your practice where you are to integrate this digital platform to take the paperwork out of the screening. We are HIPAA compliant. We are all mobile and web-based. We do have an app as well, but all of our care coordination services and screening can be done digitally without actually accessing the app. Next slide, please. So our care coordination is one of the things that really sets Mama apart. So once a patient has screened, the average communication between a care coordinator and that parent is 67 touch points over a 6-week period. Our care coordinator is actually going to seek out and find if therapy is needed. A therapist that is taken by their insurance or Medicaid, or if they want to private pay, that's fine as well. But all of our therapists are trained specifically in the perinatal mental health period. And we are on average finding them an appointment in less than a week. So I think we all know that right now, that piece of paper, you have to call every single person on the list, hope that they're trained, hope that they don't have a wait list, and hope that if they do, you can get on it. And our care coordinators take all of that guesswork out and do that for the parent. Next slide, please. So Mama is a safety net for everyone. So this is a safety net for the doctors. So again, Dr. Perez that shared how excited she was to work with us. We want our OBs, our clinicians, our labor and delivery nurses, our NICU staff to know that they have a mental health safety net underneath them. So it starts with the screening process, but that we don't go away from there. We're making sure that their parents are taken care of until they're better. And next slide, please. So our clinical framework that works, 90% of our patients are engaging in care, which I don't think I have to tell you how incredible that is, that we're actually getting responses from people and getting them the help that they need. We offer crisis triage consultation as well for our doctors. So as part of that safety net, you know that your parents are being taken care of, but if you have a situation, if someone screens positive for thoughts of self-harm, we will offer crisis consultation. Our clinicians can support your doctors and actually making sure that you can keep a mom out of the ER if possible. That's one of the things that we specialize in and are most proud of. Next slide, please. And I will close with an exciting new partnership that we're offering. So Mama is partnered with MyLuma, which is the first clinically validated biomarker blood test to predict the risk of postpartum depression. There's a couple of press releases out here on this. We can share some more information with you, but we will serve as the complete clinical wraparound solution for MyLuma and are very excited to be here today. So thanks again, Adrienne.
Thank you, Crystal. And we see some hearts going up. You know, we've talked with hundreds of providers, as I'm sure all of you have, and, you know, they are so afraid to screen because then it's like, what do I do next? And so you give them the, here's what you do next, right? And so screening, of course, is the first step, but an important step to start the conversation and to get moms connected with the care that they need. So we're so thrilled. We know Mama has been in the trenches working on this for many years. It's great to see your company and your platform evolve and really, see that you're filling this very, very important niche.
Well, and I'll say thank you so much for saying that, Adrienne, about Evolve. I want to mention that also we're able to translate our screens into any other languages and are working on culturally competent screenings as well. So just know that that's something that we're bringing into the fold too. Again, thank you for having us. Good to see you.
Terrific. Good to see you. And Crystal pointed something out that most of us do this work because of our lived experience. Nobody grows up saying, hey, I'm going to start a platform that screens moms for postpartum depression. But when you have a bad experience, you want to do something about it. So thank you, Crystal and the team at Mama for stepping in and filling that gap. And we will have time for Q&A at the end. Yeah, so somebody put in the chat how to join Mama. So do you want to answer that question real quick and then we'll move on?
Sure, absolutely. I will put a link to our website in. You can send a direct.
Oh,
thank
there
you
we go. Yep.
You can send a direct query through there. I'll also put my email address in, and we can get an office onboarded in less than a day. So it would be an honor to take
Awesome.
care of patients. Thank
And
you.
everybody's contact information and their websites are also included at the end. So we will have a slide like this after each person's presentation, and then there will be information again at the end as well. So terrific. All right, thank you, Crystal. So next up, we have Baby Scripts. Baby Scripts has been around for about 10 years. Is that right, Sarah? It's been a while. It's been a song. Yep, not new to the market. And they really focus on remote patient monitoring for many things during the postpartum period, but mental health in particular. So Sarah Nicholson is the Senior Vice President for Marketing and External Affairs. Welcome, Sarah. Let us hear more about Baby Scripts.
Thank you, Adrienne, and thank you all for joining. Along with leading marketing and external affairs, I'm also part of the founding team. And so I've been in this space for over 10 years, and I'm really proud to see all of these companies that are supporting maternal mental health. So Baby Scripts is a remote patient monitoring platform specifically for pregnancy and postpartum. We monitor for various risk factors, and the goal is to identify that risk earlier so that we can have the appropriate stakeholder intervene and ultimately improve outcomes. Next slide. So as Adrienne said, we've been in the market for over 10 years. We currently manage about 350,000 pregnancies across the US annually, and we work with over 800 practice locations. So we partner directly with the provider of care. So OBGYNs and midwives use our platform to help manage their patient population from confirmation of pregnancy through 1 year postpartum. So when a patient comes in for their confirmation of pregnancy, their provider would essentially prescribe Baby Scripts, which would allow that patient to download our app, which is full of gestationally appropriate content that guides with daily education and reminders. Along with the thousands of pieces of content that are already in our platform, a provider group can also customize that content. So they can be directing their patients to recommended pediatricians, to community-based services, or tours of L&D. There's a lot of flexibility with the platform. We also have the ability to run assessments through our app, whether that be clinical health history assessments, social determinants of health, or mental health assessments. And they can be timed to be delivered each trimester or at a certain point. Based off of that patient's responses to those assessments, we are alerting their care team to let them know of that risk, whether it's mental health or it could be clinical health history. We also have very robust remote patient monitoring programs. So if a patient was screened to have risk factors of preeclampsia, for example, their provider would give them a cellular-enabled blood pressure cuff, and Baby Scripts would pair that patient with an OB-specific care manager who would be communicating and educating that patient about risk factors, monitoring their blood pressure and trends in blood pressure, confirming those readings, and then ultimately communicating back to the provider to let them know that something might be wrong and that the provider should intervene. So we do a lot in the pregnancy and postpartum period, but when we talk specifically about mental health, next slide, we do have quite a bit of standard content already in our app to guide a patient through video meditations or to find support during prenatal or postpartum. And so we are directing those patients to established resources and customized provider resources. Next slide. And as I mentioned before, the whole goal of our program is to identify the risk earlier so that there can be an intervention and management of that risk. And we do that through our in-app assessments, and we can also do that through our care manager interactions. So a care manager is meeting with a patient on a monthly basis at the very least, and they're able to screen for that risk live and communicate back to the provider. Next slide. Because we've been in the space for a long time, we've had the opportunity to publish quite a bit of research that we're really proud of. Some of the items that I'll call out is one, when it comes to mental health, we did a study with George Washington University in DC that looked at utilization of mental health screenings in an app versus standard of care. So think you're in a clinic filling out a paper form. And we found that we had significantly higher utilization with the in-app screenings, particularly in the first half of the pregnancy. So again, trying to identify those risk factors earlier so that there can be intervention. Additionally, we spend about 3 hours of time per month with a patient, the care manager and patient spending about 3 hours of time per month. So that really gives an opportunity for us to identify that screening when that patient is outside of the clinic. When it comes to blood pressure, it's kind of one of the core programs that we offer. We've also done quite a bit of research. One statistic is around health equity. We did a study in South Carolina that looked at blood pressure ascertainment remotely versus in clinic. And not only did we increase that ascertainment remotely, but we also completely eliminated this disparity between Black and white patients. And finally, just with all of our deployments, we've seen a significant reduction in time to detect preeclampsia. So really proud of the outcomes. We continue to do additional research around different risk factors in pregnancy and postpartum. So if you would like to learn more, please feel free to reach out to me or go to our website. And thank you, Adrian.
Oh, that was terrific. Thank you so much, Sarah. And just as a reminder, all of our webinar participants' emails and contact information will be shared at the end. So scan the QR code and visit their website, but we can also directly connect you with Sarah. So Sarah, I did note that you said that Baby Scripts covers about 350,000 pregnancies, manages that number of pregnancies right now. That's amazing. That's about 10% of pregnancies in the United States. So hats off. That's great. So terrific to see moms getting care that they need. And I want to point out that both Sarah and Crystal before her, and you'll hear from others as well, really talk about care managers as being essential in this work. And it sounds like those care managers really take the responsibility off the shoulders of the OB or the OB staff, or can help augment to really play that important role of care management, which we know is so important when moms are struggling with their mental health. They do not have the capacity often to be doing all of that, calling for providers. You're caring for a newborn, you're not feeling well. So to have somebody by your side to help navigate and coordinate all that is just really terrific. So I sense that is a key part of the Baby Scripts formula.
Yes, exactly. We all know that providers and clinic staff are just so overwhelmed, oftentimes double booked appointments. And so anything that we can do to take away the administrative burden while still providing high quality care is really our goal.
Perfect. All right. Thank you so much, Sarah. Great to have you with us. All right. We are going to shift gears here for a minute and talk about collaborative care. Our next 3 companies focus on supporting the collaborative care model. Family Well and Concert do it in the obstetric setting, and Triple Moon also works in the pediatric setting. So what is collaborative care? Next slide, please. It is a very specific model of care. It's an evidence-based approach to integrate behavioral or mental health care within the primary care setting. And so it started in PCP or family practice, but has been proven also very effective in the obstetric setting. And so the goal is to improve quality and accessibility of mental health treatments for common mental health conditions such as anxiety and depression. So it's perfect for maternal mental health because most women really are, um, having symptoms that their obstetric provider can treat if that provider has the knowledge and the backup support, which is what the collaborative care model provides. So it involves a team of medical and mental health professionals. And again, the care manager you see on the right is the center of the collaborative care model and is embedded in the obstetric or pediatric or primary care setting and does all that coordination with the patient, with the primary care provider, with on-site therapists perhaps, and then with a consulting psychiatrist. And so it's a well-researched and well-proven model of care. Next slide, please. In fact, it has specific billing and financing information, all that supports collaborative care. So there are ways to get reimbursed for implementing this model in your practice. Specific billing codes for collaborative care since 2017. The codes are listed here. I'm not going to go through all of them, but we just wanted to provide this as a resource. So as you dig into this more, this is what our next three companies have expertise in. And in fact, when you hear from Verna Little, she's been doing this for many, many, many years and is really the guru on some of this information. So we're going to tee up our next companies that are focusing on collaborative care. So next up is FamilyWell. Dr. Jessica Galton is the founder and CEO. She is also a mother, and she is going to talk about kind of what brought her to this work as well as what FamilyWell does. So Dr. Galton, welcome. Great to have you. Let's hear about FamilyWell.
Thank you so much, Adrienne, and to MMHLA. I'm a huge fan. I have absolutely loved partnering with you and all of the companies on this webinar. So I'm a little bit of an odd bird because I'm a neonatologist. I take care of babies in the NICU. I'm also a mom of two. This is actually a picture of me holding my son right after he was born. And I experienced postpartum depression after both of my babies. As a physician taking care of babies and families, I didn't get a single day of training on postpartum depression, how to screen, how to triage, diagnose, or treat, and missed my own symptoms for a very long time. And then fortunately, what helped me recognize that I was struggling was a female physician I worked with, a colleague and a friend who recognized it before I did. So she helped me find help. Although at the time, this was pre-COVID, it was very difficult to find help. I had the privilege of training and working at Harvard, Hopkins, and Penn, three of the top academic institutions in the country, and I could not find help for a very long time. So fast forward, during COVID, I was practicing clinically in the NICU and kept seeing mom after mom after mom struggling with her mental health. And I tell this story, I like to say, during the thick of COVID, before vaccines came out, some people adopted a puppy. I birthed a company. I decided that I absolutely had to do something about this and learned about collaborative care and said, this is absolutely a no-brainer. Why are we not doing this at scale in OB-GYN practices? So we can go to the next slide. So our mission at FamilyWell is to solve the women's mental health crisis by seamlessly embedding evidence-based, equitable, and affordable mental health care into OB-GYN practices, health systems, and really meld the behavioral health sort of wraparound support that women truly desperately need with your medical care, your standard OB-GYN care. We can go to the next slide. So really proud to share that we started really in perinatal mental health and felt really proud of the model that we developed. And we do collaborative care, plus we also do virtual therapy and psychiatric care as well. And so it's sort of like a collaborative care plus model. And so we started in perinatal mental health. We started supporting pregnant and postpartum women. We then, all of our OB-GYN providers, clinics, health systems asked us to expand our services. And so slowly we expanded to partner support. And now we support women who are trying to get pregnant with infertility struggles, preconception counseling. If you're on a medication, for example, you're trying to get pregnant, should I stop, an SSRI or other medication to get pregnant? We provide counseling in that area. We also provide mental health support for women who've struggled with loss, miscarriages, stillbirth, NICU, prematurity. And then just recently, all of our clinics and health systems have asked us sort of unanimously to expand our services from, from the OB-GYN population and include the GYN population. So OB-GYN providers do both, right? They do obstetrics and gynecology. And so, they expressed to us, 3 out of 4 women experiencing perimenopause and menopause have mental health concerns. Can you create a program for them? So we just launched that this summer. And we focus on sleep disorders, sexual drive, managing hot flashes, and pelvic floor concerns. And so really excited to announce, we haven't announced it publicly yet. This is actually the first place we're going to be announcing it, and you'll hear a lot more in press releases coming up, that we're expanding our scope as a company to include the full women's reproductive life cycle. So really, really proud. This is also a paper that's going to be coming out, and that will we can share the link with this crew. We partnered with the Meadows Mental Health Policy Institute, as well as UMass, Tiffany Moore-Seamus, and Nancy Byatt and Tiffany Moore-Seamus, some of my favorite people in the maternal mental health space, and basically showed that, in our first several hundred patients, we were able to get patients in within 24 hours to our program. So access to care is very, very important. And by the way, every single patient that enters our program gets an intake with a therapist, because one of the biggest problems is that, providers, not just OB-GYN providers, all providers who are prescribing SSRIs to perinatal patients often are doing the EPDS, right? The Edinburgh Postnatal Depression Scale, but are skipping diagnosis. So that's a screening. And then they're prescribing SSRIs without diagnosing. So that's incredibly important to us. Every patient gets a diagnosis, the right diagnosis up front, so we can create a care plan for them that's comprehensive of their needs. In this paper, we showed that 95% of patients that we supported see clinical improvement in 4 months. And then more recent data have shown that 70% of our patient population go into full clinical remission in that 4-month timeframe. And then, and so the final sort of clinical outcome here in this paper is that the average time to a clinical remission is 3.5 months in our patient population. And these are primarily women with moderate to severe depression and/or anxiety in the perinatal period. Go to the next slide. So what I love about collaborative care, which Verna has been one of the pioneers, I would call you what's the politically correct word, but you are like the mother of collaborative care. Can I say that? Is that appropriate? This is a maternal mental health.
You can totally say that. In fact, someone changed it recently to grandmother, and I thought, oh, I guess now
I wouldn't say that.
Yes.
And so what Verna has so beautifully pioneered is the collaborative care model within various different medical specialties. And what we did was we learned from Verna's work and said, okay, look, in the perinatal population, so it's really, really hard to scale therapy and psych. Right. And so we said, well, what's the missing component? It's coaching, it's peer support. It's like people who have lived experience and are highly qualified to deliver mental health support, right? So our model really is coach driven, coach first. We certify our own coaches. Many of our coaches are doulas, lactation consultants, birth workers, other kinds of birth workers, but you don't have to have any mental health or medical background to become a coach. And we'll teach you how to deliver CBT and other psychotherapy-based techniques, as well as put those skills into practice. And so coaching is so important in our model. And we also provide care management through the collaborative care model. We provide virtual therapy and virtual psychiatric support as well for those women who have complex mental health needs and may need a psychiatric provider to directly prescribe for them when the OB-GYN provider doesn't feel comfortable. OB-GYN providers typically feel comfortable with prescribing SSRIs, but not medications outside of that scope. The collaborative care billing codes, as I'm sure Verna will go into, are pretty much universally adopted by commercial and Medicaid plans. 39 state Medicaid plans, and Verna can correct me if I'm wrong on my number. 39 state Medicaid plans accept these codes. They're built into fee schedules. You can start billing them right away. And it just provides an easy, affordable, insurance-covered way to provide mental health care right in an OB-GYN setting. Oh, 34. Okay, thanks, Verna. I heard 39 for some reason. Okay. So OB-GYN providers are partnering with us, and it's a win-win-win and a no-brainer for them. And it was designed that way. The reason, not only are we providing them with, fast access to high quality insurance covered services for their patients right there in their clinic, we are also aligning financial incentives. By partnering with us, OB-GYN clinics and health systems actually make money. It's really important. Everyone wants to be paid and feel validated when they're providing a service. OB-GYN providers are doing this already. They're just not being paid for it. And this is one way that they're getting paid for it. And then we're decreasing their workload. We design this model to wrap around the provider to help offload that behavioral health work that they're doing that really puts a lot of time burden on them. So one of the biggest sort of ways that we do that is we provide crisis support. So any clinic or health system that we partner with can call us, and if a patient is in crisis, like suicidal or having a psychotic break, can call us and get a licensed mental health reproductive trained mental health provider on the phone to help triage, and then reach out to the patient and get them to where they need to go. We're keeping so many women with passive suicidal ideation out of the ED, which is fantastic. And I just have a little bit more. I'm sure I've talked for more than 7 minutes. I tend to do that. So if you're interested in partnering with us, we're in 5 states. Our hub is in Massachusetts. We're in New Hampshire, Connecticut, Illinois, Texas, and I feel like I'm missing a state. Massachusetts, New Hampshire, Connecticut, Illinois, and Texas. If you're a doula, an IBCLC, or other kind or social worker that wants to get additional training in perinatal mental health, you can take our CERT program. It's asynchronous, and you get 10 hours of mentorship. So please visit our website and reach out to me if you have any questions.
Thanks, Dr. Galton. There were a couple of questions that have come up about screening in the NICU, but I'm going to save them till the end because I want Mama to chime in on that as well. So great job. Great to hear from you. I'm so glad. I remember meeting you 2 years ago at the PSI conference, and you were just getting started, and just fabulous to see how your company has grown. And so moving now to Concert Health, we've heard Verna Little's name mentioned a couple of times. Verna is just world-renowned expert in collaborative care. She is, right, but maybe the grandmother. One of my friends, her grandchildren call her Big Mama. We're not going to call you Big Mama, but you are like big in this world. So Verna Little, please take it away and tell us about Concert.
Sure thing. Thank you. And I'm so glad to be here. I just love working in this space because as I heard everyone talk today, it just reminds me just how passionate people are and how much they care about what they do. And there isn't a single organization on this call that I haven't talked to my daughter about, who is pregnant and expecting in May. So that is just how much I admire all of the work that's happening, and it's always fun to hear what people are doing. So I'm going to talk to you a little bit about Concert, sort of speaking about labors of love. I actually co-founded Concert with Spencer, who is based out of San Diego, had a history in sort of entrepreneurial starting companies, and then I have the clinical and sort of collaborative care background. We came together about 8.5 years ago. And for me, the inspiration was because I was working with so many organizations doing consulting around the country to do collaborative care, and it wasn't working, and for reasons that I knew were fixable and that it was doable. And so I said, you know what, I'm going to create an organization that will just be the easy button so that people could have access to this model, access to evidence behavioral health treatment. And so out of that, Concert was born. Go ahead. So Concert has continued to grow. And essentially our mission, like the others on the call, is that we want people to have access to high quality evidence-based behavioral health care, that we can also care for someone same day, next day. And we're doing that alongside their healthcare provider, whether it's pediatric, whether it's OB, primary care, And we're going to continue to work on that until, like the rest of us on this call, we can make that a reality nationally. Go ahead. So Concert currently, we are in 19 states, soon to be 20 states. We have a little over 20 board certified psychiatric providers doing psychiatric consultation. We have several actually that specialize in reproductive health and work with our women's health practices. Women's Health USA, as an example, has been a partner of ours for quite a few years. We now have well over 300 master's level behavioral health providers that actually provide collaborative care to our partners across the states. Go ahead. So we've talked a little bit about collaborative care. We went through the model. Probably some of the differences with Concert is that we do have master's level clinicians are the sole behavioral health providers. They are the sole behavioral health care managers. We don't have other individuals in our model, and that we have a registry like others that is required for collaborative care to be able to really track individuals and make sure that sort of nobody falls off the map. Go ahead. So we've served over 135,000 patients at this point. Certainly a lot of women's health, a lot of family practice, also pediatrics. Like many, we started with depression and anxiety. We actually are super excited to really be working on insomnia and difficulty sleeping. We have partnered recently with the University of Washington around a special project for PTSD and bipolar. So we've actually folded that into the work that we do. There was a large trial called the Spirit Trial. And so we're working on that. And that's been particularly exciting because many women who are coming into care actually have a history, and they have a history of experiences and oftentimes don't get care or don't stay in care or don't have care accessible to them. And so the ability to really work with the providers and work with those individuals has been incredible. And I ran a report the other day for one of our new partners, and we're relaunching with them, and there were 145 women with PTSD as a primary diagnosis. So we're super excited to be able to create access and care for them. Go ahead.
I'm so glad you talked about that, Verna, because there was a question in the chat, who is anybody addressing trauma in these platforms? So thrilled.
Yeah, and you know, one of my sort of experiences over time has been that people with trauma actually do really well in collaborative care because it's very high touch. And you're really focusing on what someone's experiencing every day. And if you can change someone's daily experience, that's so empowering, and it gives them a sense of control that they haven't maybe experienced for some time. And so they tend to do really well in collaborative care. They may go on for some specialized treatment. And however, you know, oftentimes collaborative care works incredible for them. So yeah, thank you. Go ahead. So we have really paid attention to data. In fact, we just started a national group, a national research group. We have also convened a national women's health group around collaborative care, which some of my colleagues on this call are on. So I have been very interested in data, and all of us sort of reporting data together and looking at the same measures. So Concert Health has been pretty successful in really getting more than half of their individuals they're caring for to be able to have greater than a 50% reduction or 10 points in their PHQ or their GAD for depression or anxiety. We use the pediatric symptom checklist for obviously pediatrics, that's 6 to 11-year-olds. And then we're really looking to get people below 10 and hopefully below 5. And certainly a significant number of our patients have been able to get there. We use the PMQ and the PHQ simultaneously for bipolar. And so as we continue that work, I'll be really excited to be able to report some of those outcomes for that patient population. Go ahead. So we have worked for quite some time, actually, with the women's health population. We put an article out around anxiety. We've done a lot of work hoping to convene national folks to put out an OB/GYN women's health pathway to be able to support collaborative care. Right now, we have a little over 400 OB/GYN providers that we're supporting every day, and hopefully going to continue to see that number grow. We do actually support quite a few pediatric practices, both family practice and specialty pediatrics, and now supporting, actually, it's a little over 200 pediatric providers across our system. Go ahead. So one of the things that we've really looked at, I've been very interested in anxiety. We see anxiety at a much higher rate now than we used to. It used to kind of be reversed. And so one of the things that we've seen is that we've had really good outcomes for women with depression or anxiety, rather, in women's health practices. And we've seen that many of them were not on medications, that actually came in for OB care, not on medications and didn't need medications. And so it was really interesting to sort of watch people get better through collaborative care and to really engage the providers in that process. So we did actually put this article out. Dr. Stanivan actually was one of the folks on this who many of you may know in this space, certainly another individual who is incredibly dedicated to working with this population. Go ahead. So I talked a little bit about the partnership with PCORI and with the AIM Center around bipolar and PTSD. You know, one of the things that we're particularly interested in is being able to put a model together to support the continuation of collaborative care with these populations and continually show good outcomes and sort of take some of the bumps and bruises for figuring it out. But we're incredibly happy to be able to support this specialized care to our partners. Go ahead. So one of the things that we would love folks to do is to reach out. We love to partner with practices. I always think about it as like wrapping a warm fuzzy blanket around the providers that we work with. Like many of the others, you know, suicide in this population is incredibly high. As a member of the National Zero Suicide faculty, we've been able to put some pathways at concert together to really support individuals at risk for suicide. We have actually several thousand that are on our pathway, and we are continuing to support them to look at risk reduction, to be able to come up with some specialized care for them. So certainly interested in continuing to grow the population of patients that may be at risk for suicide. So very interested to partner with organizations and really interested to continue to grow and support collaborative care.
Oh, thank you so much, Verna. I love to say Verna Little is one of the most generous people with her time, with her knowledge. She wants everybody to know about the collaborative care model. And if you have any questions about any billing code, she is your go-to person. So thank you so much, Verna, for being with us.
Thank
Okay,
you.
and then last but not least, we have Triple Moon. Lauren Gage is the founder and CEO. She is also a mom herself, and she's going to talk a little bit about supporting the collaborative care model in the pediatric setting. So Lauren, welcome. Take it away.
Thank you so much. First and foremost, thank you to the MMHLA team and to all the other panelists on this call. It's exciting to see all of the different business models out there. And I'm excited to talk a little bit more about Triple Moon today. But before I do that, just a brief introduction on myself. My name is Lauren. I'm the founder and CEO. And my background is actually in finance and consulting. So like Adrienne said, no one is born thinking that they're going to find their way into mental health until you have your own lived experience. And that was very much my calling into this space. My family has needed the resources that Triple Moon now provides. And I'm very lucky to partner with our Chief Clinical Officer, Dr. Katie Sardone, who is a clinical psychologist with over 20 years of mental health experience in the pediatric and perinatal populations. So the two of us kind of lead the charge at Triple Moon with a huge team of others who help on the product ops and clinical side of things. We can go to the next slide. So what are we doing? you hear a lot, right, that raising a healthy family, we say used to take a village. We believe now it takes a miracle. Mental health is actually the #1 leading concern for parents. Above gun violence, drug, alcohol abuse, parents are worried about mental health, and it's the second leading cause of death. Suicide is the second leading cause of death amongst the pediatric population. And we know you've heard a lot of presentations about maternal mental health, that maternal mental health and pediatric mental health are inextricably linked. So at Triple Moon, we go to the next slide, we are all about helping families get the behavioral health care that they need and the personalized support that they deserve to live happier, healthier, and more productive lives. So similar to Concert and Family Well, we are an integrated behavioral health platform, and we use the collaborative care billing codes to help providers give better access to behavioral health resources and help families get the care that they need. Go on to the next slide. So why do practices partner with Triple Moon? So a lot of the benefits of collaborative care have been covered really well and are true for Triple Moon as well. So from a provider perspective, we help providers earn back valuable time. We know that mental health is triaged predominantly through a primary care setting. And so a lot of what we're doing is helping providers to practice at the top of their license while still providing their patients with exceptional and quality access to mental health resources. Similarly, we're helping those practices add immediate new sources of revenue to your bottom line through the CPT codes that have already been covered. Our process is hassle-free, right? So we have no upfront costs, no minimum referrals. We are interoperable with your EHR. And really, I would say what differentiates Triple Moon is that we are specifically focused on the pediatric population. So that means our entire team of behavioral health care managers, our psychiatric consultants, our clinical team is really bringing quite a bit of experience from the pediatric perspective. And similar to many of the other presenters, we have wonderful experience with our practices, 90% net promoter score, and patients see the impact as well with symptoms improving over a 6 to 12 month time frame. Go to the next slide. The mental health diagnoses we treat very similarly. We see a lot of anxiety, depression, ADHD, and autism are very common referrals in the pediatric space. Similarly, we also see quite a bit of trauma and PTSD. And can handle a variety of different diagnoses, but those are probably the most common symptoms that we treat. Go to the next slide. Okay, components of our comprehensive care system. So as a patient or a provider partnering with Triple Moon, you get the benefit of really 4 things. So our multidisciplinary care team, this is comprised of our behavioral health care managers. These are the folks meeting day to day with each of our patients, providing evidence-based education, behavioral health intervention, and really the care coordination resources that families need. So we will do everything from coordinating with other subspecialties, OT, PT, school counselors, IEP needs, so on and so forth, all the way through the actual behavioral health services. We have a huge database of evidence-based education that patients have access to through our app, and you'll see that on a subsequent slide. But not only are our providers kind of pulling from that standard of care when they're providing treatment, but our families also have access to those resources at their fingertips. Of course, similar to other collaborative care models, our platform is based on a measurement and accountability system, which means that part of what we're doing for providers is helping them get the ingoing diagnosis correct. I think Dr. Galton mentioned this earlier, but a lot of patients are prescribed medications and prescribed a treatment pathway without the correct diagnosis. And so a big part of what we're doing is helping families and the providers make sure that that diagnosis is accurate. And then every month screening those patients to see how their symptoms are improving. And then last but not least, we help providers with medication management. So our psychiatric team is looking at every patient that comes through our front doors, not only for their care pathway that they're on and the behavioral health intervention that we're providing, but also to make sure that their medications are correct. Is it the right dose? Is it the right time of day? Is it the right formulation? These are the types of things that, especially in a pediatric population, make a huge difference in outcomes, and it's a part of our standard offering. Next slide. Something that I think is very unique about Triple Moon is our behavioral healthcare team. We like to say that they're one of a kind. So they come into us with a ton of clinical experience. So similar to Concert Health, all of our behavioral healthcare managers have a master's level education, and they have 3 to 5 years of experience working with pediatric populations. Once we bring them into the Triple Moon sphere, we do quite a bit of hands-on training. We pull from the AIMS Center, which has a wonderful course, but then we partner on top of that with our own manualized care, which again is kind of that foundational curriculum that all of our care team is using to treat patients. And that really makes sure that every single patient receives the same level of care, no matter if you're seeing any one of the members of our behavioral healthcare management team. And then, of course, last but not least, the clinical oversight. So not only is collaborative care meant to be truly collaborative from a patient's perspective, right? Integrating the primary care provider with the behavioral healthcare manager, with the primary care provider and the psychiatric team, but we actually use that same process internally. And so every single patient not only has the benefit of working with their BHCM, but also that BHCM is also getting the benefit of working with our psychiatric team and our psychology team to make sure that the care they're providing to our patients is top notch. Next slide. The patient experience, I already hit on this a little bit, but we are a tech-enabled platform, and so we have a patient-facing app. So everything that we're doing is at the click of a button. We see patients in under a week, so that means as a provider, we can get you up and running very quickly, and you're able to make a referral. Those patients who would otherwise have been waiting 6 to 9 months for care are seen by one of the members of our team within a week. Again, we cover commercial and Medicaid. We're live in 5 states: Texas, California, Tennessee, Florida, and Maryland, and growing every day. We really put an emphasis on education. One of the biggest parts of our program is obviously not only providing the behavioral health services, but helping the whole family get access to the information and resources that they need. And then, of course, last but not least, we offer extension services. So this is whole family support, not only kind of the mental health needs of the child, but also being able to help mom, dad, or whomever the care team is with their own mental health needs via referral or via providing those mental health services through a member of our team. Next slide. And to wrap things up, would love to keep in touch. We have several open roles for behavioral healthcare managers. We also have a patient success team that helps with care coordination. So if you don't have your master's level degree, but you want to work in this space, that's a wonderful role. And of course, if you're a practice that's interested in bringing pediatric collaborative care services to your patients, we'd love to hear from you. And with that, I think I'm turning it back over to Adrienne.
Great. Thank you so much, Lauren. Wow, what a great presentation from all of you. Terrific information. Next slide, please. So as a reminder, after this webinar, we will email you a survey to get your feedback, help us improve. These presentation slides, a recording of the webinar, a fact sheet with information about each one of these companies, and registration for part 2. Next slide, please. So we're also going to drop just a real quick poll. It's just one sentence. Did you find this webinar helpful? We hope that you did. We hope that you will join us for our second part of this webinar series on October 23rd. And as you're filling out that poll, we'll transition to our next slide, please. And it's time for some Q&A. So we do have time for just a couple of questions. Here's the registration for part 2. So one of the questions is about culturally competent care. I am guessing that many of you, like me, are of course, very aware that women of color are disproportionately impacted by many, many challenges, including maternal mental health conditions. And just real quick, if you are, have anything to offer on this topic about what your specific platform does to address or provide culturally competent care, would love to hear just a couple of words. And I see Crystal came off mute.
Oh, yes, I got an invitation to come off mute. Thank you.
Okay.
Good answer first. Yes, our clinicians, so anyone who is panel within MAMA receives specialized perinatal care training, and cultural competency is at the core of all the trainings that we offer. In addition to that, not only for our clinicians, but also for our care coordinators.
Terrific. Anybody else want to chime in on this one? The other question that was in the chat was about screening in the NICU. So we heard Dr. Galton talk about this. I know Mama is partnering with NICU at Children's National Hospital in Washington, D.C. and doing screenings in, is it the Fairfax or the Inova system in Virginia to do screenings in the NICU. We know these parents are super high rates for primarily anxiety. So Crystal, do you want to mention that real quick?
Sure, and I'd be happy to pass it back to Dr. Galton as well. Yes, we are currently partnered with the March of Dimes NICU Family
Right.
Support Network.
Mhm.
And so, yes, we began in Children's National with our pilot program several years ago, and the March of Dimes program was born out of that. So we are in just over a dozen hospitals with the March of Dimes currently.
Great.
And yes, to your point, we're screening right there. We're also in several pediatric offices. And so the AAP recommends screening at 1, 2, 4, and 6 months for parents. And so that can actually be billed as well. And it looks like Lauren might be mentioning something of that as well. So, and Dr. Galton, I'd be happy to pass it back to you for how you're screening in the NICU.
Thanks, Crystal. I love that you're screening in the NICU and involving neonatologists. I think that's incredibly important. Just putting on my neonatologist hat back on, in the NICUs, I've found that the screening piece is oftentimes now electronic, it's built into Epic and other EHRs often, and of course not everywhere, because obviously Mama has a footprint in those places where they don't have electronic screening yet. I think the biggest challenge really is, if we detect, what do we do? Where do we send them? And so, similar to OB-GYN providers and other frontline medical providers, neonatologists, we also have, I mean, I can't speak for everybody, but I can speak for myself, that when I was practicing 100% clinically, I was scared to screen, because if I detected somebody who was struggling, I literally didn't have anywhere to send them. So it's really about the what's next after screening, and having the screening and the appropriate referral source or
Yeah.
built-in integrated platform is really, having those two hand in hand is really what's going to get more providers to screen in the NICU.
Absolutely, 100%. Nobody wants to screen if they don't know what the next steps are. We totally understand that. Well, we are at the top of the hour. We're actually a minute past. I want to be respectful of everybody's calendar, their schedules. We are so grateful for our terrific panelists. Please give a round of applause. We see there's lots of questions in the chat about insurance and financing the different programs and how much do they cost. So if you have specific questions for each of our wonderful panelists, you can direct it directly to them. Next slide, please. Again, we will be sending out a follow-up email. This is information about each one of our companies. We do have permission from our panelists to share their email, so we will be sending that in our follow-up email as well, so you can get in touch with them directly. This has really been terrific. It's like a dream come true. After so many, months of talking about this and planning, we pulled it together. I learned so much. You all really made it simple to understand sort of these complex, I mean, they're simple to you, but for somebody who's learning about it for the first time, kind of a complex set of resources that you provide. So this was super, super helpful. Thank you all for being with us. We hope that we will see you again in a month for part 2 of this webinar series, and enjoy the rest of your day.